Active Together is a service for cancer patients that will help them through their treatment. It consists of 3 key parts.
From physical activity to nutrition to psychological support. And it's all designed to help that person to give them the best support that we possibly can to have positive outcomes after their cancer diagnosis.
Yorkshire Cancer Research is really excited about Active Together. We really value bringing world-class cutting-edge research and putting it into practice here and now. And in this instance, we have Sheffield Hallam University and the Events Wellbeing Research Centre and the world-class academics coming together with Sheffield Teaching Hospital and their excellent clinicians to provide a service for cancer patients funded by Yorkshire Cancer Research.
My name's Prof Gary Mills. I'm an intensive care consultant and anaesthetist. My role in Active Together is chair of the clinical advisory group. I've spent 25 years looking after patients with major surgery, both in theatre and then afterwards with their complications on the high dependency or intensive care unit.
Being physically active is important for anyone, but for cancer patients, it can be a very useful treatment in and of itself.
If you have a cancer diagnosis, the evidence tells us that actually physical activity can really help with fatigue. It can help to reduce the number of circulating hormones in your system, like sex hormones such as estrogen, and also high levels of insulin. And that reduces progression and development of cancer.
It was November time, and I was due a diabetes check. And the nurse said, "Is there anything else the matter with you?" Well, at the time, I was particularly exhausted during the day all the time for about 2 weeks. I went to the doctor for some blood tests. They came back negative. And they sent me for some scans, and the outcome was that I'd got cancer of the gullet, and I needed radiotherapy and chemotherapy. The way the Active Together has helped me is that it's given me more energy, more mentally, more focused. I do a lot more exercise and walking than I did before.
The typical patient experience for Active Together would start with a 90-minute an hour consultation with one of our physiotherapists. And that's all about understanding the needs and the preferences of the patient, what matters most to them. We'd then work with the patient to design a physical activity or a nutrition or a psychological support program that's based on their treatment plan, but also their individual needs and those of their family.
Yorkshire Cancer Research and Active Together have made a big impact in my life. They've helped me recover tremendously, given me a good outlook on life, and made the future look very, very bright, given me more energy, more of myself than I was before.
In the past, I've seen patients who've been tested in a variety of ways, and it's been clear they've not been fit enough for their cancer surgery. And a small number of them have gone away, worked hard, got fitter themselves, and have re-presented several weeks or months later, and then been shown to be fit enough to have a better risk enough to allow them to have surgery. So the Active Together programme potentially could provide that extra fitness, that extra training, and there could be more patients like that who otherwise wouldn't get their treatment.
My hopes for the future of Active Together is that it expands across Yorkshire, so that we're able to provide services that support people with a cancer diagnosis to prepare well for and recover from their treatment, and ultimately improve the quality of life of thousands of people with a cancer diagnosis across this region.
Every cancer patient deserves to benefit from a programme like Active Together. With the generous support of people in Yorkshire, Yorkshire Cancer Research is making this a reality.